on the News Channel 5 network. This is Morning Line.
Oh, good morning, everyone. Thanks for joining us on Morning Line. Get up here, Dennis. Come on, sit down. Let's go. All right, we're talking this morning with dentists, all right? It's going to be our medical-related program. We're going to open up the phone lines for you in a moment. We don't have just one dentist on this morning. We have two. And this is something we do pretty much every 2 or 3 weeks. And the whole idea here is for you to call in if you have questions. I was talking to Steve Hayslip during the tease this morning about, was he more afraid as a child of the dentist or the doctor? Or maybe he wasn't afraid of either. I always liked going to the dentist. I thought it was pretty cool. I mean, the dentist, usually I left and they gave me sugarless gum or things like this, and it didn't hurt in my mind as much as it did with the doctors, where I'd sometimes get shots or things like that. Steve said it was the dentist with him, and that's one of the things we can talk about among others in terms of dealing with pain and fear of dentistry. And there are adults that still feel that way, but boy, I'll tell you, the advancements they've made to make it easier for you when you go to the dentist, better than ever, and they can do more with your teeth. So the number, 737-7587, questions or comments, and we'll get into a broad range, whatever you want to talk about. With our two guests this morning, they're both dentists, okay? They don't work together. They have independent practices, is my understanding. With us this morning, Brandon Sims. You know Dr. Sims. He's been on before. And Rick, you just sat down. Thank you. Where did you wander off to in the building?
I had a phone call.
And I thought you were hiding and were getting stage fright or something.
No, I'm okay.
Dr. Rick Horwat with us as well, a dentist. Well, it's good that we found you. This is a big building, easy to get lost. But
thanks.
Appreciate you coming on. All the cameras are locked down, and we're going to take phone calls and talk. But I thought get a little bit of background on both of you. And I know we'll get to Brandon in a moment, but first time I've had you on, Rick, and give us a little bit of your background as a dentist. How long have you been a dentist? Where were you educated? Things like that. And where's your office?
Okay, we have two offices. I'm with Bluegrass Endodontics now.
Okay.
Let me see. I graduated from the University of Pittsburgh in 2004. I did general dentistry in the Annapolis, Maryland area for about 6 years. Kind of focused on aesthetic dentistry. Took all the right CE courses, everything like that, and I really enjoyed being a dentist. Yeah. I started doing root canals just about every day. And
do you like doing root canals?
I didn't at first. My first root canal probably took 6 hours.
Wow.
Yeah, it did.
Okay.
It took a long time, and then because you're taking so many X-rays, you want to get it perfect. And then next thing I know, I'm doing them every day. Yeah. And then after about 5 years, 6 years, I says, I should probably be doing root canals as a
It's more fun to do root canals than to have one, I think.
I'm pretty confident that's accurate.
But thank goodness for them. Yeah. Well, listen, thank you for coming on this morning. It's a pleasure. Good back. You like doing root canals?
I do.
Yeah. What's fun about root canals? You both. I know you've told me before you wanted to be a dentist. You like the dentistry. What is it about being a dentist you like so much? Just curious.
For me, it's we get to help people.
Yeah.
But
there's a lot of jobs where you can help people.
Well, and while doing that, I get to work with my hands. It's artistic. It's a lot of fun.
That's what some people forget. There is a certain degree of artistry or creativity that goes into dentistry, doesn't it? When you have a situation where you have to get to something in someone's mouth, and there's more than one way you can deal with it. Be it crafting the filling, something like that. Now, is it all done computerized, or how smooth you make a filling in someone's mouth?
It's going that way. Not fillings necessarily, but crowns are definitely going.
Yeah, or crowns. Crowns now are fat. You guys take the mold and you give us a temporary while the real one's made.
Yep.
That is then permanently put in.
Most cases, yeah.
Okay. Well, anyway, we'll get into all this. We can take phone calls. In fact, we have one now. I've got a bunch of questions, and we can go in any direction with you two this morning. But let's take a call real quick from Donnie before our first break. Donnie, good morning.
Good morning.
Hey, Donnie, what's on your mind, my friend? How are your teeth?
They bad. I pull them myself.
Oh.
I can't afford to go to a dentist.
Are you serious?
Yep.
Okay, wait a second. So how did you pull a tooth? And tell me, was it there was a bad cavity, there was decay, and what did you do?
Well, there was my tooth. One time my tooth come out, and I pushed it back in there and had to go to the emergency room. But I don't do that no more. But when they, I usually, when they get so bad, instead of the pain, I just yank them out.
Holy cow. All right, what is your question?
When are they going to, take care, and the doctor's going to make payment plans and stuff like that for people?
Yeah, well, maybe we can talk a bit about that, guys. And I don't know if you handle things differently. First of all, what do you do when you hear a call like that? Can you imagine someone pulling out? First of all, this is America, greatest country in the world. And we have people that for whatever reason don't feel they have access to fine dentists like yourself, and they're yanking their own teeth out. It's just wrong. It's wrong. It's embarrassing for this country that that's actually happening because they can't afford it. What do you think when you hear someone pulling out their own teeth?
Well, we do our best to work with as many people as we can.
Yeah.
Financially, we have financial partners that we use to help us.
Yeah.
There are options in the community for lower cost dental care. We have a dental school here in Nashville, which is great. And then there's, we've talked about just about every time I come on the show, there's 2 or 3 different low cost or sliding scale clinics within Nashville that are, their mission is to help people just like that.
Yeah, some people obviously we have insurance, and some don't. You can go in and pay for it. Typically, for an example, I mean, Dr. Horwat, what does it cost to pull a tooth? I know
I'm an endodontist. I really don't pull too many teeth anymore. Oftentimes, if a patient is sent to me and it gets to the point where we feel that the tooth is non-restorable, we'll usually even call the general dentist and ask them, is it okay if I extract this tooth while the patient's numbed? Or sometimes a general dentist will have a specific oral surgeon that they like to actually work with. And I really feel like it's their call if someone's referred to me. But with regard to what the caller had said as well, I wouldn't recommend pulling your own teeth. No. Too many things can go wrong. And we do have a pretty good emergency system here. If you go to the hospital, worst case scenario, you're in pain, someone's going to take care of you. If you don't have the finances, you're going to be taken care of. That's the bottom line. I strongly encourage people not to pull their own teeth.
Right.
I have had patients come in with when I was a general dentist, with large infections from them trying to do that.
Yeah.
And I wouldn't recommend going that route.
Yeah, and we should clarify too, when we talk about, obviously, dental pain and chronic pain like that, it's awful. That's why root canals, we were talking about that. No one likes a root canal, but when you're feeling that pain prior to that, I'm so glad to see you guys, because gosh, it takes the pain. But if you don't address pain and issues in your mouth, that can affect the rest of your health, can't it? I mean, we're talking infections, things like this that can go, elsewhere in your body. True?
Yep.
All right. So
they can actually be life-threatening.
That's what I was thinking. That's what I just want to say. Ignoring the dental pain, and as it gets, I always think about Tom Hanks in the movie Castaway.
Yeah.
Remember that movie? And he had the abscess in his mouth. We've talked about this before. And of course, he's on an island, doesn't have, and it just kept getting worse and getting worse. And finally, he had to knock it out of his mouth with a rock because he had no other choice. And it hurt so much.
I think it was an ice skate.
Right, it wasn't. Yeah, I think it was. He held the ice skate there and had a rock here and went bam and knocked the tooth out. I guess you do it, but that's if you're stranded on a desert island.
Right.
If you're in this country, and I think you're absolutely right, people like Donnie need to seek out, go and get that treatment for it one way or the other. It's going to be taken care of, and there are people who are indigent out there, but they don't need to be walking around with abscesses in their mouth.
That's right.
All right, listen, we're going to take a break. When we come back, we're going to get more phone calls. We'll get into more with our guests this morning about just the very latest in dentistry. Try to cover as many bases as we can this morning. We're going to 9 o'clock. The line's open, 737-7587. Jump in. Any questions about your teeth right after this?